Hi, Dr. Stacy Toro and everybody. My name is Brian, and today I'm gonna talk about the American Association of Critical Care Nursing Healthy Work Environment Survey. And this is for advanced nursing leadership classes. So in 2005, the American Association of Critical Care Nurses, or the AACN, has made a commitment to actively promote the creation of healthy work environment that support and foster excellent inpatient care, wherever acute and critical care nurses practice. Thus, they provide a framework of evidence-based standard called Healthy Work Environment Assessment Tool. This has become a national standard for nursing work environment guidelines over the years and is still essential to achieve and maintain healthy, fulfilling workplace conditions and optimal patient outcomes. So, the Healthy Work Environment Assessment Tool includes 6 standards. They are the 6 standards for establishing and sustaining healthy work environment, represent evidence-based relationship or center principles of professional performance. They are including skill communication, true collaboration, effective decision making, appropriate staffing, meaningful recognition, and also authentic leadership. So the assessment tool have different scoring guidelines. They are if the score is 3 or lower, which means that category needs improvement. From 3 to 3.99 is categorized somewhat healthy. From 4 to 4.99 mean moderately healthy. And lastly, if the category score from 5 or higher, it means it's very healthy. So I did conducted the healthy work environment assessment tool on the unit that I work, which is the ICU of UCI Fountain Valley. So after the survey, if we compare the result to the national benchmark of 2025, we can see that they are all significantly lower than the average requirement. The overall score, I can only get 3.23, which is just past the improvement borderline. And you can see the 3 area that score the lowest is skill communication, only 2.94 compared to 4.16. True collaboration, 2.67 compared to 4.01. And lastly, authentic leadership only scored 2.98 compared to 4.36. So now we will explore the problems and the solutions and what the APRN position can do to improve those areas. So first of all, let's talk about the first area that needs improvement. This is skill communication. So what is skill communication? This is an essential skill that must be prioritized and developed in healthcare workplace environment. Making skill communication an important component of your program because ineffective communication can compromise patient safety and sometimes leads to serious consequences. As we mentioned above, this skill communication only scored 2.94, which is fall into the category needs improvement. So what are the problems for skill communication? It can be namely lack of influences, which means registered nurse valuable insights from direct patient care are not reaching those who make strategic decisions, potentially hindering effective policy making and resource allocation. Um, Furthermore, they might feel feelings of disempowerment. We can explain that nurses may feel their voices are not heard or valued, leading to disengagement, frustration, and a sense that their concerns are ignored. The longer those feelings occur, a persistent feeling of being unheard by leadership can erode trust in the organization's commitment to its nursing staff, and a healthy work environment can be established. So, what the solution and the APRN role in this? Um, First of all, we can create team engagement and dialogue by determine how best to address the challenges identified. And also we can conduct open forum meetings or small group discussion with those who participate to validate results and learn what areas matter most to the staff. Furthermore, we can tailor interventions by recognizing that changing individual behaviors may require different interventions than changing organizational behaviors. We can also join forces with multidisciplinary team leaders to identify strengths, opportunities, and barriers relating to achieving skill communication. And last but not least, we can incorporate the AACN Health Working Environment Standard into the existing meetings, like patient routes, huddles, clinical practice work groups, in order to achieve effective skill communication. So let's talk about our second area that need improvement. That is true collaboration. So what is it? True collaboration is defined as using unique abilities as professional through skill communication, trust, knowledge, shared responsibilities, mutual respect, optimism, and coordination of patient care. According to AACN, and in the survey, this category is also only scored 2.67, which needs a lot of improvement. So, what are the problems for an effective true collaboration? Well, when nurses feel they cannot truly collaborate with their direct supervisor or higher management, it will create a hierarchical barrier. It hints at a command and control structure rather than a truly collaborative one, as the concern as RN are not effectively integrated into decision-making processes, policy development, or even day-to-day unit operation. Um, Also, if disagreement is handled poorly, it can fester into tension and damage relationships. Unresolved conflict will erode trust, impair team cohesion, and divert energy from patient care. It can also create a hostile and uncomfortable work environment, which will impact nursing satisfaction and retention. Um, if nurses feel a gap between themselves and the management regarding decision-making process and unresolved disagreement, this will negatively impact patient outcomes, increase the risk of errors, and create friction of inefficiency within the care team. So, what can we do to improve true collaboration, and what's the APRN role in this? First of all, we have to acknowledge that true collaboration is a process that requires continuous attention and nurturing. This will set a long-term mindset for change and improvement rather than just a short-term goal. Furthermore, we can engage in open conversation with the team leaders and upper management and other colleagues to identify strengths, opportunity, and barrier to achieve true collaboration. very similar to skill communication as well. Also, we can incorporate AACN standard into current organization to create a profound understanding between staff and the management. Alright, we have come to the last area that we need to talk about. This is authentic leadership. So what does it mean? Authentic leadership is defined as a nursing leader who fully embraces and motivates other staff to promote a healthy working environment, according to AACN. If authentic leadership is absent, nurses and other healthcare staff will be challenged to deliver optimal contribution to patient care. And this area also only scored 2.98, which needs a lot of improvement. So let's identify the problems of authentic leadership. Based on a survey, nurses do not perceive leadership as effectively promoting professional practice environment. Thus, it leads to disconnection between the organization values and daily basic practice. And the lack of inspiration can lead to decreased morale and engagement within working individuals. So if the leaders are not seen as authentically supporting professionalism, it can lead to a disconnect between the staff and the organizational values and daily reality. Nurses may feel that professional standards are not genuinely upheld or that their professional autonomy is not respected. This can create discouragement and professional growth decrease and ultimately impact job satisfaction. And last but not least, inconsistent in management have made it difficulty for staff to seek opportunity to grow effectively. So what are the solutions and the role IPRN in this? So there we can do that, implement training program specifically designed for nurse manager and top level leadership, focusing on the principle and behavior of authentic leadership and psychological safety. Second, leaders at all levels must conduct transparent communication, active listening, and respectful interaction to all the staff, unit-wise and organizational-wise. we also there's an idea that we should employ nursing manager full-time that committing to the facility culture and guidelines rather than just rotating temporary manager and start the whole process again. According to Harvard Business Review, there are 4 types of leaderships: pioneers, drivers, integrator, and guardians. In my opinion, I view myself as an integrator leader. They possess some of the characteristics like skill at building relationship and fostering teamwork. They usually bring harmony, facilitate communication, and mediate conflicts between the staff. They also value collaboration, is often empathetic and understanding as well. They are good at connecting diverse groups and align efforts. And last but not least, they play a vital role in ensuring team cohesion and morale. So, in conclusion, the AACN Health Working Environment Assessment Tool for this ICU reveal an environment that's significantly challenged by fundamental issues that require urgent and strategic intervention. In order to achieve a truly healthy work environment, this ICU must embark on a dedicated, multifaceted improvement plan, and we have to do it as soon as possible because failure to address these foundation problems will likely lead to low morale, increase burnout, hinder recruitment, and ultimately jeopardize patient care and safety. Thank you everybody for listening.